So are drug companies lying to us? Well, in some cases they are very misleading. If you've been down to your local pharmacy or grocery store nowadays, you probably have seen all the availability of medications over the counter. And if you're trying to find a medication, it can often be difficult. And drug companies don't make this any easier. There are often multiple brands of multiple manufacturers that are all making the same medication. So just because you see a name you recognize doesn't mean you're going to get the right medication. And as a pharmacist, I'm all the time talking to customers. I recommend certain medications to them. And the other day I came across something that really showed me that drug manufacturers can be very misleading in how they are marketing and presenting these medications and make it confusing for the buyer, and ultimately you may even get the wrong medication if you don't watch out. So stick around. In this video I'm going to show you a real life example of how not reading the drug's label can ultimately lead to you buying the wrong medication. So the example that comes to mind that happened the other day, someone came in for a recommendation on a medication. They were looking for Unisom, and they were using it to treat nausea and vomiting related to pregnancy. So I walk over to the sleep aid section of our over-the-counter medications, which is where Unisom is commonly found because it can also be used to treat insomnia. Most OBGYNs will recommend it in the first trimester to help with nausea and vomiting related to pregnancy. This is the medication that was recommended by the doctor. Unisom sleep tabs. There is 25 milligrams of doxylamine in this. This is the one that treats nausea and vomiting in pregnancy. It also helps you fall asleep. Right beside it on the shelf was Unisom sleep gels. So on first glance you may say, well, one's a tablet, one's a gel capsule. Uh, Gel capsule may work a little faster. Tablets are able to be broken in half if you need a lower dose. So I can pick which one is best for me, right? Well, that's not the case in this situation. The sleep gels of Unisom contain 50 milligrams of diphenhydramine. So, diphenhydramine, if you don't know, is Benadryl, is the brand name of diphenhydramine. Does help you sleep. Also can be given to treat allergies or allergic reactions, whereas doxylamine is for sleep. Doesn't work as well for allergic reactions or allergies. So this is a very misleading branding. Both of them say Unisom. One says sleep gels, one says sleep tabs. The only difference is the active ingredient, and that's the most important differentiation between the two. You can see where this can be misleading and get you into trouble if you're trying to find a certain medication over the counter. Unisom is using marketing to have the brand name Unisom as a sleep agent and selling diphenhydramine at a higher cost. So just to look at the difference between the two, Unisom sleep gels with 50 milligrams of diphenhydramine at Walmart right now cost around $15. If you get the exact same Equate brand of Benadryl, you're going to be looking at anywhere from $6 to $10 for the same size bottle of the exact same strength of Benadryl. So there's a drastic difference in price, almost double in some circumstances, for the same medication with a different brand marketing it as a sleep agent as opposed to a allergy medication. So are drug companies lying to us? Well, in some cases they are very misleading. It's very important if a doctor recommends a medication to you or a pharmacist and they're not actually handing you the medication, if they tell you to get something, make sure you're looking at the active ingredient and ask the doctor or pharmacist or healthcare provider what active ingredient medication you're looking for. Often different companies are going to be making the exact same product, all with different labeling, and it has the same ingredient in it. I think this is very alarming as a pharmacist because, as I said earlier, I'm recommending a lot of medications to patients over the counter, and I feel like we need a little more transparency from the drug companies in how they are marketing and labeling these medications. Because in the example I showed you, The boxes look identical. The only difference is the active ingredient. So if you don't know what you're looking for, you really need to pay attention. Ask a pharmacist if you have any questions and let them show you how to see what active ingredient you need and how to find that on the labeling. So this isn't the only example of misleading branding. There are multiple examples. If you'd like to see a video on that, leave a comment. Leave a comment as well if you've ever seen this in your personal life where you were going to buy medication, it looked like you were getting the right thing and you got the wrong drug because of the branding of the medication. I just think that these companies should be more transparent on how they're labeling these things. Thanks for watching, guys. See you in the next video.